Good morning, ladies and gentlemen. Sabah. We shall consider item 7, awards. Excellencies, distinguished delegates, ladies and gentlemen, the 4 prizes we've been presented today honor individuals and institutions for their outstanding contributions to the human health. However, before we continue, I wish to inform you that during its last session, the Executive Board established the Nelson Mandela Award for Health Promotion and agreed to streamline the procedures with the view to bestowing the first award during this assembly. Unfortunately, it has not been feasible to complete all the steps called for by the streamlined procedures under the tight time frame that was foreseen. Importantly, it has been suggested by some member states and interested parties that the mechanism that had been put in place for awarding the prize would benefit from further consideration in order to give the prize the full significance and importance and award established in recognition of Mr. Nelson Mandela's legacy in the field of the health deserves. Therefore, it is considered preferable that the first delivery of the prize be postponed to next year in order to review and propose to the Executive Board a broadening of the selection committee. The Secretariat therefore intends to report back on this matter to the next session of the Executive Board, proposing to review the status and a proposal for forward the current nominations onward, along with the revisions to the relevant item for implementation at WHA73. Please refer the document A72/INF/1 awards for more information on their work and achievements. I will now give the floor to the Director General, who would like to say a few words. Dr. Tedros, you have the floor, please.
Thank you, Mr. President, Excellencies, ladies and gentlemen. At the beginning of the week, I said that health is about political leadership, health is about partnership, and that ultimately health is about people. That's what today's awards are about, people. I'm proud to be here to honor the work of 7 outstanding individuals and institutions. These awards not only honor the individuals and organizations themselves, they demonstrate to the rest of us what's possible. They help us to aim higher. They show us humankind at its best. This year's awardees have helped to protect women from HIV and viral hepatitis in Cameroon, reduced anemia among children in Peru, made water safe to drink in Tanzania, trained health workers in more than 140 countries, improved the care of geriatric patients in Spain, pioneered low-cost medical devices for cardiology care in India, and strengthened community health in Myanmar. These are the researchers, the innovators, the health professionals, the humanitarians who spend their lives in the service of others. They do not wait for a resolution to guide them. They are guided by the desire to alleviate the suffering of others. I thank each of the 4 foundations who so generously support these awards: the Sasakawa Memorial Health Foundation, the United Arab Emirates Health Foundation, the State of Kuwait Health Promotion Foundation, and the Dr. Lee Jong-wook Memorial Fund. And I congratulate the 7 laureates for their outstanding contributions to human health. Professor Judith Ndongo Imbola Torimiro from Cameroon, Signor Eusebio Quisipe Rodriguez from Peru, the National Center for Global Health and Medicine of Japan, Dr. Askwar Hilonga from the United Republic of Tanzania, the Aging and Fragility in the Elderly Group of the Research Institute of La Paz Hospital in Spain, Professor Bolram Bhargava of India, and the Health Promotion Unit of the Department of Public Health in Myanmar. Each of you are worthy recipients of these prizes, and I salute you. Thank you.
Thank you, DG. It is now my pleasure to announce that the 2019 Sasakawa Health Prize has been awarded jointly to Professor Judith Ndongo Embola Torimiro, Chantan via International Reference Center for Research on the Prevention and Management of HIV/AIDS, Cameroon, and Senior Eusebio Quispe Rodriguez, former mayor of the district of Iguén in Peru. I invite Mr. Ishiro Kabasawa, Executive Director of the Nippon Foundation, to address the Assembly on behalf of the Sasakawa Memorial Health Foundation. Mr. Kabasawa, you have the floor, please.
Dr. Bunkun Shibohan, the President, World Health Assembly, Dr. Tedros Adhanom, Director General, World Health Organization, ladies and gentlemen, a very good morning. I am very pleased to announce that the 35th WHO Sasakawa Health Prize Award will be awarded to Professor Judith Ndongo Torimiro and Mr. Eusebio Quispe for their outstanding and notable advances in primary health care. Health is now an essential factor in sustainable development goals and the goals of other international development programs. But 40 years ago, health and development were not considered interrelated. Therefore, the Alma Ata Declaration in 1978 was truly groundbreaking because, for the first time, health was linked to development. And in the declaration, the primary healthcare approach became the critical to achieve health for all. Through this approach, people in local communities are encouraged to become proactively involved in their health development. They learn how to improve their diet in daily life. They learn the importance of good hygiene. They have access to basic health care. And in the process, they learn how to take the initiative to improve their health. This leads to prevention of diseases or early treatment, and it contributes to their well-being. In the past 40 years, the world situation has significantly changed, and the primary healthcare approach has responded accordingly. And that approach continues to be recognized as fundamental to achieving the goal of health for all. The Sasakawa Health Prize recognizes those who are applying this approach to promote health in their respective fields. I would like to honor the 2 recipients this year who are making significant contributions to health for all through the primary health care approach. Professor Torimiro, a specialist in infectious diseases, applies the primary health care approach through the training of health care workers in the areas of HIV/AIDS in Cameroon. She's also active at the grassroots level, increasing awareness of cancer and sexually transmitted diseases among women in the region. Mr. Kispe applies the primary health care approach to raise awareness of nutrition among local people in disadvantaged areas in Peru. He and his team visit families in the affected areas and advise them how to improve their daily diet. This has resulted in a dramatic reduction in cases of anemia. Health is a basic human right. The contribution of the 2 recipients this year reminds us that the primary health care approach enables everyone to come and enjoy this right. Professor Torimiro and Mr. Kispe, congratulations.
Thank you, Mr. Kabazawa. It is my privilege to present this prize to Professor Judith Dongo Ebola Torimiro.
The President of the 72nd World Health Assembly, the Director General of the WHO, Your Excellencies, ladies and gentlemen, I would like to thank you for the honor of being selected for the Sasakawa 2019 Health Award. My sincere gratitude goes to the government of Cameroon for nominating me for this award. I acknowledge that this award, although personal, has resulted from teamwork. Some of the team members are in the audience. Viruses move and adapt. Viruses can move from one animal to another. HIV may have moved from another primate to humans. And after 27 years of work to describe the molecular epidemiology of HIV and related viruses and the impact on diagnosis and treatment outcome, we can say that Central Africa, where Cameroon is situated, is the epicenter of AIDS, because a virus moved from another primate to humans. In spite of this, I still eat bushmeat. Hepatitis B virus, on the other hand, can also be transmitted from a mother to a child as HIV. I am now motivated to contribute to knowledge on mother-to-child transmission of hepatitis B virus and no longer zoonotic transmission of viruses. Therefore, I would use these funds of this award to support operational research, to strengthen the health system of Cameroon, to integrate prevention of mother-to-child transmission of hepatitis B infection into the successful ongoing HIV PMTCT program, and thereby promote the vision of the First Lady of Cameroon, Mrs. Chantal Biya, to provide better quality of life for mothers and their infants. Today, we have access to diagnosis of HBV infection, hepatitis B vaccine, hepatitis B immunoglobulin, and antivirals against hepatitis B. Can we therefore encourage pregnant women to get tested for hepatitis B and advocate for free testing for HBV infection for these women, as in the case of HIV infection? Thank you for your attention.
Thank you, Professor. And now it is my privilege to present this prize to Dr. Wisława D. Pawlikowski, who is accepting it on behalf of Senior Eusebio Quispe Rodriguez. And what he said. Okay.
Señor Presidente de la Asamblea Mundial de la Salud, señor Director General de la Organización Mundial de la Salud, señor Director Ejecutivo de la Nippon Foundation, señor Kawasawa, señoras y señores, en nombre del Perú y en especial de los pueblos indígenas, andinos y amazónicos que luchan contra la desnutrición crónica y la anemia, agradezco este reconocimiento hecho al exalcalde de la provincia de Higuaín, señor Eusebio Quispe, que también significa un testimonio del esfuerzo y los logros del pueblo y las autoridades de esta provincia en la región de Ayacucho para evitar que los niños sean afectados por la anemia en su desarrollo motor y cognitivo y en su capacidad de ser a futuro mujeres y varones plenos y felices. El esfuerzo del Estado peruano para luchar contra la anemia no daría resultados sin la participación social de las personas, familias y comunidades, con el apoyo de las autoridades electas y comunitarias, los maestros, el acompañamiento de los promotores de salud, terapeutas tradicionales y el esfuerzo del personal de salud del primer nivel de atención. La experiencia de la comunidad de Higuaín es una demostración de ello, del liderazgo de una autoridad preocupada por el futuro de sus niños y jóvenes, que es secundada por su pueblo. La anemia es cruel, trunca vidas y futuros. El Estado peruano, asumiendo otro principio de la Conferencia de Alma-Ata, la intersectorialidad, implementa un plan multisectorial de la lucha contra la anemia que suma a todos los sectores del Estado liderados por el Presidente de la República, que ha unido a congresistas, políticos, medios de comunicación, sociedad civil y, lo más importante, a los ciudadanos de a pie de todo el país. Nuevamente, muchas gracias por este reconocimiento.
Thank you, Doctor. It is now my pleasure to announce that the 2019 United Arab Emirates Health Foundation Prize has been awarded jointly to the National Center for Global Health and Medicine, Japan, and Dr. Aswa Hilonga, United Republic of Tanzania. I invite Dr. Hussein Abdul Rahman Anran, Assistant Undersecretary, Health Centers and Clinics, Ministry of Health, to address the Assembly on behalf of the United Arab Emirates Health Foundation, please.
معالي الدكتور تدرس أدنهم المدير العام لمنظمة الصحة العالمية، أصحاب المعالي وزراء الصحة، أصحاب السعادة، أعضاء الوفود وممثلي المنظمات المشاركة، السيدات والسادة، السلام عليكم ورحمة الله وبركاته. باسم مؤسسة الإمارات العربية المتحدة للصحة يشرفني أن أرحب بكم جميعا في هذا الاحتفال السنوي الذي تنظمه منظمة الصحة العالمية لتكريم الأطباء والعلماء والمؤسسات والشخصيات التي أسهمت في إثراء العمل الصحي وتعزيز دور المنظمة الرائد في المحافظة على صحة وسلامة الإنسان. كما أغتنم هذه المناسبة لأتقدم بالجزيل الشكر لما يبذله جميع أعضاء المجلس التنفيذي للمنظمة من جهد في الإعداد لتكريم الفائزين بهذه الجائزة. السيدات والسادة، انطلاقا من الرؤية الحكيمة لقيادة دولة الإمارات العربية المتحدة لدعم العمل النبيل لمنظمة الصحة العالمية، جاءت جائزة الإمارات العربية المتحدة للصحة حافزا لحث الفائزين لتحقيق المزيد من الإنجازات التي تعود بالنفع والفائدة على صحة وسلامة الإنسان، حيث تساهم بالاشتراك مع منظومة الأمم المتحدة بشكل عام ومنظمة الصحة العالمية بشكل خاص في برامج توفير الصحة للجميع في كافة أنحاء العالم. وفي هذا السياق ساهمت جائزة مؤسسة الإمارات للصحة التي أنشئت عام 1995 والتي حصل عليها خلال هذه المدة 38 شخصية ومؤسسة ومنظمة صحية غير حكومية حول العالم في تطوير وتنمية العديد من المؤسسات والبرامج ذات الطابع الصحي والإنساني في العديد من الدول. السيدات والسادة، إنه ليشرفني أن أعلن من هذا المنبر بأنه تم منح جائزة الإمارات العربية المتحدة للصحة لعام 2019 لمرشحين اثنين، وهما المركز الوطني للصحة والطب العالميين من اليابان والدكتور أسوار هدونوغا من جمهورية تنزانيا المتحدة. لقد اخترنا المركز الوطني للصحة والطب العالمي ومكتب الصحة الدولية التابع له لما يقدمه بالتعاون مع مكتب المساعدة الإنمائية الرسمية التابع لوزارة الخارجية اليابانية، وكذلك مع الوكالة المنفذة مثل الوكالة اليابانية للتعاون الدولي وغيرها من الوكالات والمنظمات الدولية، بما في ذلك منظمة الصحة العالمية من مساعدة فنية وإجراء البحوث وتنظيم الدورات التدريبية وإنشاء شبكات للصحة في العديد من المجالات التي تشمل مكافحة الأمراض المعدية والموارد البشرية للصحة وصحة الأم والطفل والسرطان وأمراض القلب والأوعية الدموية والشيخوخة وتحسين نوعية الرعاية والحد من وفيات الأطفال وتحسين صحة الأم ومنع انتشار الأمراض، وهو ما يساهم بشكل مباشر في تعزيز أهداف التنمية المستدامة وبفضل مستشاري المركز تم تدريب أكثر من 4100 فرد في أكثر من 140 دولة. كما اخترنا الدكتور سكور هلوناغا من جمهورية تنزانيا المتحدة المتخصص في تكنولوجيا النانو، والذي يبحث منذ سنة 2011 في المواد النانوية التي يمكن أن تكون مناسبة لتنقية المياه بهدف تحسين الوصول إلى مياه الشرب المأمونة وتقليل عدد الوفيات بسبب المياه الآسنة. لقد استخدم الدكتور هلوناغا أثناء عمله في معهد نيلسون مانديلا للعلوم والتكنولوجيا مواد متناهية الحجم والدقة لتطوير نظام تقنية المياه في المنازل والمدارس في المناطق الريفية في جمهورية تنزانيا المتحدة بتكلفة منخفضة، حيث يتم امتصاص الملوثات والقضاء عليها مثل المعادن الثقيلة السامة والبكتيريا والفيروسات وغيرها من الملوثات من التعدين والنفايات الصناعية وشبكات الصرف الصحي. السيدات والسادة، إن دولة الإمارات العربية المتحدة بإسهامها في منح جائزة الإمارات للصحة فإنها تتطلع دائما إلى تشجيع الباحثين والعلماء على مواكبة التطورات المتسارعة التي يشهدها عالمنا اليوم والتوصل إلى أساليب أكثر فعالية في التغلب على التحديات الراهنة. وفي هذا السياق ومن منطلق المساهمة مع المجموعة الدولية في توفير الصحة للجميع والقضاء على العديد من الأمراض الحساسة مثل شلل الأطفال، التي تعد بلادي من الفاعلين الرئيسيين من أجل إيجاد عالم خالي من جميع فيروسات شلل الأطفال على أساس دائم، فإنه من دواعي الشرف أن أعلن عن تنظيم دولة الإمارات العربية المتحدة بالتعاون مع منظمة الصحة العالمية مؤتمر المانحين للقضاء على هذا المرض في أبو ظبي خلال شهر نوفمبر 2019. وفي الختام أتوجه بالشكر والتقدير والتهنئة للفائزين بالجائزة هذا العام، كما أؤكد مرة أخرى على مواصلة دولة الإمارات العربية في تقديم كل من شأنه أن يعود بالخير والنفع على البشرية جمعاً. والسلام عليكم ورحمة الله وبركاته.
Thank you, Dr. Aran. And now it is my privilege to present this prize to Dr. Aswa Hilonga.
Dear dignitaries, ladies and gentlemen, this is a wonderful occasion, not only for me, not only for my family, not only for the Republic United of Tanzania, but also for the underserved communities worldwide. I'm so privileged and so grateful for this award that is granted unto me, and it has inspired me to work hard and intensify my effort to provide safe and clean water by using my own invention, the nanofilter invention. Ladies and gentlemen, I grew up from a poor community in rural Tanzania in a village called Gongali. And as a little boy, I struggled a lot with waterborne diseases. And I was wondering as to why nobody could not step up at that time and solve the problem. And that is why, after finishing my PhD studies in South Korea in nanotechnology, I decided to solve this problem for good in my lifetime. And that is how and why I came up with the nanofilter invention. The invention that's making impacts. Thank you very much. We are making impact to hundreds of thousands of people in Tanzania and Kenya, and the innovation is about to scale up now to Zambia and Uganda. And I'm being challenged now by WHO, because we are talking now about the global issue, that I should not think of becoming a millionaire, which was my mission, but now I want to be a billionaire, not in terms of money, but in terms of impacting billions of lives. And now, thank you very much. So I'm so grateful to the Republic of Tanzania. The representatives are here, including the minister and the people from the Ministry of Health. God bless you. I'm here to save my people and the world. God bless you.
It is my privilege to present this prize to Dr. Norihiro Kokudo, who is accepting it on behalf of the National Center for Global Health and Medicine in Japan.
Okay. So, Mr. President Bukong, WHO Director General Dr. Tedros, Your Excellencies, ladies and gentlemen, I am truly honored to be here today to receive the United Arab Emirates Health Foundation Prize. The National Center for Global Health and Medicine, NCGM, has been providing medical services since 1868. Then, in 1979, the year after the declaration of Alma-Ata, we started dispatching medical doctors to refugee camps around the world. Now, 40 years later, the timing of this great honor is fortuitous as we reaffirm the importance of primary health care. On behalf of NCGM, I would like to express our deepest gratitude to the UAE Health Foundation. Since we founded the Bureau of International Health Cooperation in 1986 at NCGM, we have strived to be a leading Japanese corporation in the health sector. And we have worked in collaboration with the WHO, Japanese government, and many partners. We dispatch experts to technical cooperation projects. We train health personnel domestically and internationally. And we conduct health researches. And we send medical relief teams in response to natural disasters and epidemics. NCGM continues to stand on the side of those who need our assistance and to work together to find solutions. Mr. President, Dr. Tedros, thank you for this prize. And I would also like to thank all colleagues in the global health community for their selfless cooperation. This is but one step toward our dream of health for all, and we cannot and will not rest until it is a reality. As your long-standing partner and friend, we, NCGM, will continue to work tirelessly toward a healthy world. Thank you very much.
Thank you, Dr. Hilonga. It is now my pleasure to announce that the 2019 His Highness Sheikh Sabah and Ahmad and Jabir and Sabah Prize of Research in Healthcare for the Elderly and in the Health Promotion has been awarded to the Aging and Fragility in the Elderly Group of Research Institute of La Paz Hospital, Spain. I invite His Excellency Dr. Basil Hamoud Al-Sabah, Minister of Health Kuwait, to address the Assembly on behalf of the State of the Kuwait Health Promotion Foundation. Your Excellency, you have the floor.
معالي رئيس الدورة 72 لجمعية الصحة العالمية، أصحاب المعالي نواب رئيس الدورة ورؤساء اللجان، معالي دكتور تدرس أدهانوم المدير العام لمنظمة الصحة العالمية، أصحاب المعالي والسعادة وزراء الصحة ورؤساء وأعضاء الوفود، الزملاء والزميلات، الحضور الكرام، السلام عليكم ورحمة الله وبركاته. إنها لسعادة غامرة أن نجتمع اليوم في هذا المحتفل الدولي المرموق لنشترك معا في تقديم جائزة حضرة صاحب السمو الشيخ صباح الأحمد الجابر الصباح في مجالي الرعاية الصحية للمسنين وتعزيز الصحة للفائز بها عام 2019، وهو فريق الباحثين المعني بالشيخوخة والهشاشة لدى كبار السن بمعهد البحوث بمستشفى لاباز بمدينة مدريد بإسبانيا. وأنني إذ أتقدم بخالص التهنئة للفائز بالجائزة متمنيا لهم المزيد من الإنجازات للابتكار والتطوير للرعاية الصحية لكبار السن، فإنني أنتهز هذه الفرصة لأؤكد على اعتزاز دولة الكويت بعميق العلاقات مع منظمة الصحة العالمية، والتي ترجع جذورها إلى القرار رقم 11 الصادر عن جمعية الصحة العالمية رقم 13 المنعقد في مايو 1960 بانضمام دولة الكويت إلى عضوية المنظمة. كما أؤكد على حرص دولة الكويت على التطوير المستمر لتلك العلاقات والمشاركة الفعالة بأعمال المنظمة، بما يؤدي إلى تعزيز الأمن الصحي وضمان تمتع الجميع بأنماط عيش صحية وبالرفاهية في جميع الأعمار. وأن جائزة صاحب السمو الشيخ صباح الأحمد الجابر الصباح في مجالي الرعاية الصحية للمسنين وتعزيز الصحة التي نحتفل اليوم بتسليمها للفائز بها تعبر عما يوليه سموه حفظه الله ورعاه عن الاهتمام والرعاية اللا محدودة لها لبرامج والاستراتيجيات الصحية في قلب الخطط والبرامج التنموية، كما تلقي الضوء على ما تحظى به وما تمثله رعاية كبار السن والتحسين المستمر لجودة حياتهم من اهتمام رفيع المستوى لا يتوقف فقط عند حدود دولة الكويت، بل يتعداها ويمتد إلى جميع أنحاء العالم. ومن خلال مبادرة جائزة حضرة صاحب السمو الشيخ صباح الأحمد الجابر الصباح في مجال الرعاية الصحية للمسنين وتعزيز الصحة تحت مظلة منظمة الصحة العالمية وتحت رعايته السامية من أمير الإنسانية حفظه الله ورعاه. وبهذه المناسبة ومن هذا المنبر المرموق فإننا نتقدم لمعالي سموه حفظه الله نتقدم لمقام سموه حفظه الله ورعاه بخالص الشكر والامتنان على هذه اللفتة السامية الكريمة التي ليست بغريبة على السجل الحافل بالعطاء المتدفق واللامحدود لأمير الإنسانية، والتي تشهد به المنظمات الدولية ومن بينها منظمة الصحة العالمية التي نتشرف جميعا بعضويتها ويجمعنا اليوم هذا اللقاء تحت مظلتها. وبهذه المناسبة فإني أتوجه برسالة العرفان وتقدير ووفاء لكل كبار السن بجميع بقاع العالم دون تمييز، وأطمئنهم بأننا لن ننساهم بالبرامج والاستراتيجيات المعززة للصحة وتقديم الدعم اللازم لضمان حصولهم على حقوقهم الكاملة في الصحة والحياة. واسمحوا لي أن أتقدم بالشكر لأسرة هيئة الجائزة وأمانة المنظمة على ما بذلوه من جهود مخلصة للتنظيم ودراسة طلبات المتقدمين المتنافسين واختيار الفائز بالجائزة من جانب المجلس التنفيذي باجتماعه رقم 144 وبشفافية ومهنية تتفق مع أهداف وإجراءات الجائزة، ولتحقيق الهدف الذي نصبو إليه جميعا وفاء وعرفانا لكبار السن بجميع أنحاء العالم، وتشجيعا للمبادرات والبحوث التي تهدف إلى ضمان تمتعهم بأنماط عيش صحية ورفاهية. وأكرر شكري وامتناني لكم جميعا، كما أكرر ما تعهدنا عليه جميعا لبذل المزيد من الجهود والعمل المشترك تحت مظلة منظمة الصحة العالمية لتقدم نحو تحقيق الأهداف والغايات العالمية للتنمية المستدامة حتى عام 2030، والتي تمثل الصحة الهدف الأسمى والأقوى والدافع لها. والسلام عليكم ورحمة الله وبركاته.
Thank you, Excellency. It is my privilege to present this prize to Dr. Pilar Zayas Lopez, who is accepting it on behalf of the aging and fragility in the elderly group of the Research Institute of La Paz Hospital, Spain. Dr. Lopez, you have the floor.
Señoras y señores, distinguidas autoridades, en nombre del Grupo de Envejecimiento y Fragilidad del Instituto de Investigación del Hospital La Paz y como coordinadora del Grupo de Trabajo Registro Nacional de Fractura de Cadera, es un gran honor para nosotros recibir este premio. Queremos agradecer a la Organización Mundial de la Salud que nos haya concedido este galardón, en especial al Emir de Kuwait y a su Fundación para la Promoción de la Salud. Shukran. También deseamos manifestar nuestro agradecimiento a la Ministra de Sanidad, Consumo y Bienestar Social del Gobierno de España y a las instituciones que han apoyado esta candidatura. Nuestro objetivo es mejorar la atención a las personas mayores con fracturas. En el mundo, más de 1,5 millones de personas sufren una fractura de cadera cada año, 3 cada minuto. Después de la fractura, 1 de cada 4 pacientes fallece. Un año después, otro no puede volver a su domicilio y solo uno de ellos puede recuperar su autonomía previa. Estos resultados mejoran con la atención conjunta entre profesionales, geriatras, traumatólogos, rehabilitadores, anestesistas, internistas y enfermería, entre otros. Y es de esa colaboración conjunta como ha nacido en España el Registro Nacional de Fracturas de Cadera. Queremos dedicar ese homenaje a más de 200 profesionales de más de 70 hospitales en España que, además de su labor asistencial, están haciendo un trabajo voluntario de recogida de datos continua para detectar áreas de mejora y proponer cambios. Contamos ya con 20.000 casos para la investigación. El reconocimiento que hoy recibimos aquí en Ginebra servirá para mantener nuestra motivación y la continuidad del registro, así como nuestro compromiso con el paciente anciano, que es el verdadero protagonista de nuestros esfuerzos diarios, con el fin de alcanzar la salud para todos. Muchas gracias.
Thank you, Dr. Lopez. It is my pleasure again to announce that a 2019 Dr. Lee Jong-wook Memorial Prize for Public Health has been awarded jointly to Professor Balram Bhargava, India, and the Health Promotion Unit of Department of Public Health, Myanmar. I invited Dr. Mo Jin-cho, President of the Korean Foundation for International Healthcare, and address to Assembly on behalf of the Lee Jong-wook Memorial Fund. Dr. Chu, you have the floor.
Honorable President, Director General, distinguished delegates, ladies and gentlemen, I am Chu Moo-jin, President of Korean Foundation for International Healthcare. Call it coffee. It's my honor to attend this World Health Assembly to present the award to the recipients of the Dr. Lee Jong-wook Memorial Prize for Public Health. I am privileged to pay my respects to the late former Director General of the WHO, Dr. Lee Jong-wook. The Korean government and COFI have put a wide range of efforts to honor the legacy of Dr. Lee Jong-wook. In recognition of his contribution and inspiration to the global health, the Korean government chose him as 2018 Person of Distinguished Services to Science and Technology. He unfortunately passed away 13 years ago while preparing for the World Health Assembly. However, his spirit is still with us. That is, do the right things in the right places and in the right way. Dr. Lee Jong-wook Memorial Prize for Public Health was established in collaboration with the WHO, the Minister of Health and Welfare of the Republic of Korea, and COFI. The prize has been awarded since 2009 to choose who have significantly contributed to the public health. This year, we have had many competitive candidates that the prize selection panel had difficulty deciding who wins the prize. On the other hand, it's the evidence that we still have so many things to do. I am pleased to announce that this year, the Nobel Prize goes to two entities. One is Professor Balram Bhargava from India. Another one is Dr. Tan Nguyen Thun, Dr. Nang Nang Shein, and Dr. Nguyen A. Thun from Myanmar. First, let me introduce Professor Balram Bhargava. He works in Ministry of Health and Family Welfare of India. He is a professor of cardiologist and executive director for School of International Biodesign, and serves as one of the leaders in biomedical innovation, public health, medical education, and medical research. During his tenure for over 25 years at All India Institute of Medical Sciences, he has treated about 250,000 patients and trained over 200 cardiologists. Also, he established the biodesign program, which has led to 10 startups and created over 30 low-cost medical devices. The most notable one is the platinum iridium coil coronary stent, which has benefited several thousand patients at lower cost. Next, let me introduce the three prize winners from Myanmar. Dr. Tan Nguyen Thun, Dr. Nang Nang Shein, and Dr. Nguyen A. Thun work in the Ministry of Health and Sports, Myanmar. In Myanmar, delivery of healthcare services is more challenging because 70% of the population lives in rural areas. The government of Myanmar required measures to fulfill the changing health needs. To be in line with the government efforts, they have developed and implemented a plan for community health clinic model. This model is the action-oriented public health care activity focusing on screening and treatment of uncomplicated diabetes and hypertension, health care for aging population, and health literacy promotion. It contributed to strengthening healthcare system in the country and induce health-seeking behaviors of the beneficiaries through early detection, prompt treatment, education, and health literacy promotion. The work and the achievement of 4 laureates is truly meaningful as it helped the public, including the disadvantaged, to receive more accessible health services, thereby promoting universal health coverage. In recognition of their efforts and great will that are most consistent with the spirit of Dr. Lee Jong-wook, we have selected them as the recipients of the 11th Dr. Lee Jong-wook Memorial Prize for Public Health. I sincerely hope we will also have many promising candidates next year, so we can see and share our concerted and sustained efforts to achieve universal health coverage. There are many people around the world still suffering due to lack of infrastructure and poor accessibility to health services. With our efforts, we can take one step further to ensure no one left behind, uphold the invaluable spirit of Dr. Lee Jong-wook, that is, do the right things in the right places, in the right way. Thank you for your attention.
Thank you. It is my privilege to present this prize to Professor Baram Pahagawa, India.
Mr. President, Honorable Excellencies, dignitaries and illuminaries, ladies and gentlemen. It is indeed an honor to be here. I sincerely thank the Dr. Lee Jong-wook Memorial Foundation and the World Health Organization for conferring this honor on me. In today's world, we have to take science, technology, innovation for the translational benefit of society. Gone are the days of export-led innovation. Today, we need globally networked innovation. The North has to work with the South. The East has to work with the West to innovate for the problems of the society at large. The problems of the world are plenty. It is always a humbling experience to serve people who suffer. We work with patients, I think, how to apply science to alleviate their suffering. Day after day, this gives meaning to everything else we do. A physician treats one patient at a time. A researcher helps larger groups, as his knowledge and innovation can spread to many patients. However, a policymaker can and must bring it all one step further, take those decisions that would ensure the whole population of a country or the globe at large. In this 150th birth anniversary of Gandhi, 150th birth anniversary of Gandhi, let our lives be our messages. I will present a copy of this to the President and the DG after the ceremony. I'd like to thank, most of all, India, the All India Institute of Medical Sciences, the Indian Council of Medical Research, the Government of India, Ministry of Health, for providing me the opportunity. I wish to thank my colleagues and friends to take this health agenda forward. I wish to thank my late parents, who have always been an inspiration for me, as well as my family. My wife, Sunita, has been a pillar of support in all my endeavors. I wish to thank both my boys, who are physicians and taking this agenda forward. I thank you for your attention. Attention is the rarest form of generosity. Thank you so much.
Thank you, Professor. And now it is my privilege to present this prize to Dr. Tan Win Toon, who is accepting it on behalf of the Health Promotion Unit of the Department of Public Health in Myanmar. Dr. Toon, you have the floor.
Good morning, Mr. President, DG from WHO, Honorable Excellency, distinguished guests, ladies and gentlemen. I am deeply honored to receive the prestigious Dr. Lee Jong-wook Memorial Prize for Public Health 2019 on behalf of Health Promotion Unit of Ministry of Health and Sports of Myanmar. Our State Councillor, Her Excellency Dr. Aung San Suu Kyi, even mentioned that the good health of public is the best fortune for the country, and we cannot get that fortune easily as a gift from others, but acquired through intellect and zeal. The community health clinic model is public health care action-oriented activity, focusing on health screening of the common NCD, hypertension and diabetes screening, treatment of the uncomplicated cases, elderly care, and health literacy promotion. The pilot model was conducted in Peru Rural Health Center, Ngaphe Township in Magui region. The trainings were provided to our basal staff for management of the cases, with regular supply of essential medicines and equipment was ensured, and in coordination with the various stakeholders. I would like to thank the Executive Board of WHO for awarding this prize. Myanmar is moving towards UAC, and this award is a catalyst for our current activities. And the health staff are more energized and charged up to take up new and challenging projects, which will work in the benefit of the communities. I also would like to express my sincere thanks to Your Excellency Dr. Min Tui, Union Minister of Health and Sports, for his guidance and encouragement to implement this community health clinic model. Last but not the least, I would like to extend my deep appreciation to the business service professionals and community members who actively involved in this endeavor. The entire journey was a learning experience for me, and with the success of this project, I am the environment. Once again, thank you everyone. Have a great day.
Thank you, Dr. Toon. This concludes our consideration of item 7 of our agenda. Next will be photo opportunity. Okay. Before we move to item 6, I would like to give the floor to the Director General to announce the Director General's special recognition award to His Excellency Professor Khan Boubacar, Minister of Health, Islamic Republic of Mauritania, on the occasion of the World No Tobacco Day, 31st May. Dr. Tedros, you have the floor, please.
Thank you, Mr. President, Excellencies, distinguished delegates, ladies and gentlemen. 2 years ago, two days ago, I had the honor of recognizing His Excellency Dr. Al-Rabi'a for the accomplishments of the Kingdom of Saudi Arabia in the area of tobacco control. Today, it gives me great pleasure to recognize the Islamic Republic of Mauritania for its fight against tobacco. Like Dr. Al-Rabi'a, His Excellency Professor Boubacar has demonstrated extremely strong commitment to tobacco control. Just after he took office as Minister of Health in 2016, one of the first things he did was a request he made to his Prime Minister to programming the tobacco control bill that had been pending at the National Assembly since 2013. Professor Boubacar made the adoption of tobacco control bill a top priority for the Department of Health, despite enormous resistance. But he defended the bill successfully in Parliament, and it was adopted on 14 May last year. The law on production, importation, distribution, marketing, promotion, and consumption of tobacco products in Mauritania is now in place and is in line with the WHO Framework Convention on Tobacco Control. Following the adoption of the law, Professor Boubacar continued to demonstrate his leadership in tobacco control and supported the adoption regulations to make the law compliant with the WHO FCTC. In December 2016, Professor Boubacar addressed a letter to his counterpart in the Ministry of Finance suggesting an increase in taxes on tobacco products. The fact that the country has been able to make significant progress in the fight against tobacco is largely due to the strong and continued support received from His Excellency Minister of Health, Professor Boubacar. It gives me great pleasure to give him this award to be received on his behalf, to be received by Minister Boubacar. We have the privilege of having him. Initially, there was a representative, but we're glad to have him with us. Back to Your Excellency.
Thank you, Mr. DG. We go there. Excellency, you have the floor.
Monsieur le Président, Monsieur le Directeur Général, honorables invités, Mesdames et Messieurs, Je voudrais tout d'abord exprimer mes sincères remerciements et ma profonde gratitude au directeur général et à travers lui l'Organisation mondiale de la santé. La remise de ce prix aujourd'hui, en ce jour mémorable, le vendredi 24 mai, et dans cette célèbre salle des assemblées, constitue une fierté pour tout un pays et pour tout un peuple. Elle prouve aussi la détermination de l'Organisation mondiale de la santé à lutter contre le fléau que constitue le tabagisme. Sans doute, la reconnaissance de notre travail par l'Organisation mondiale de la santé nous encourage à aller de l'avant dans notre lutte contre le tabagisme. Monsieur le directeur général, mes premières pensées vont à mon ministre, professeur Khan Boubacar, qui a bien voulu être parmi nous aujourd'hui. Il m'a chargé de vous transmettre ses remerciements et sa reconnaissance. Monsieur le directeur général, si aujourd'hui les conséquences néfastes du tabac sur la santé et le bien-être sont connues de tous, plusieurs millions de personnes dans le monde continuent à fumer, sachant que plus de 4000 substances chimiques se trouvent dans la cigarette, dont 50 produits sont cancérigènes. Ça fait peur. Je pense à ces millions de femmes et d'hommes qui luttent pour la survie contre le cancer et ces milliers de personnes affectées par les maladies cardiovasculaires. Monsieur le Président, Monsieur le Directeur général, la Mauritanie a pris cette menace de santé publique avec grand intérêt. En renforçant son arsenal juridique, une loi a été votée par le Parlement en mettant l'accent sur la prévention à travers des programmes dédiés à la lutte contre le tabac et ses méfaits, en créant des structures modernes de prise en charge, le Centre national de cardiologie et le Centre national d'oncologie. En conclusion, pour partager cette joie, Monsieur le Directeur général, je réitère et je renouvelle, au nom de son Excellence, Monsieur le ministre de la Santé, professeur Khan Boubacar, notre invitation à visiter la Mauritanie. Vous êtes les bienvenus. Enfin, je demande à tous de considérer la journée d'aujourd'hui, journée sans tabac. Je vous remercie.
Thank you. We shall now consider item 6 of our agenda on election of the Executive Board. I draw your attention to the list of the 12 members contained in document A72/22 drawn up by the General Committee in accordance with the Rule 100 of the Rules of Procedure. If elected, these 12 members would provide a balanced distribution of the board as the whole. These members are in the English alphabetical order: Argentina, Austria, Bangladesh, Burkina Faso, Grenada, Guyana, Kenya, Singapore, Tajikistan, Tonga, Tunisia, United Arab Emirates. Is the Assembly prepared in accordance with the Rule 78 of the Rules of Procedure to elect these 12 members as proposed by General Committee. I see no objection. I therefore declare the 12 members elected. This election will be duly recorded in the records of the Health Assembly. We will now consider Item 8 of our agenda on the reports of the main committees. Let us consider the first report of Committee A, which is contained in document A72/69. The report contains one solution. The resolution is entitled Program Budget 2020-2021. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is therefore adopted, and the first report of the Committee A is before approved. Let us now consider the second draft report of the Committee A, which is contained in document A72/70. The report contains 3 resolutions. One resolution as amended, entitled Primary Health Care. One resolution entitled Community Health Workers Delivery Primary Health Care, Opportunities and Challenges. One resolution entitled Preparation for the High-Level Meeting of the United Nations General Assembly on Universal Health Coverage. Is the Assembly ready to adopt the 3 resolutions? I see no objection. The resolutions and the second draft report of the Committee B is therefore approved. Let us consider the first draft report of Committee B, which is contained in document A72/71. The report contains one decision. The decision is entitled Health Conditions in the Occupied Palestinian Territory, including East Jerusalem and in the occupied Syrian Golan. Is the Assembly ready to adopt this decision? I see no objection. The decision and the first draft report of the Committee B is therefore approved. This completes our work for the 6th plenary meeting. Committees A and Committee B will now resume their work respectively in rooms 19 and 17. Both committees will hold afternoon sessions from 2:30 to 5:30 p.m. The meeting is adjourned. Thank you.